Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today I'm going to talk about forceps delivery or forceps extraction as part of my labor series of videos. There's another video on vacuum delivery, and I encourage you to watch that. They're very similar. The indications for forceps delivery are very similar for the indications of a vacuum delivery, and that is in order to expedite the delivery, get the baby out sooner when the baby is in distress or concern, and that staying in longer would be a potential risk to the baby. So that's a way of getting the baby out faster than the potential alternative, which is a cesarean section. Or when the mom has been pushing for a while and has kind of reached the limit where it's approximately 3 to 4 hours for the first baby and 2 hours for the second baby when we start getting to a prolonged second stage of labor, and that's where it might be a consideration. Or also when mom's exhausted after pushing for a while and not making progress as an option. So which to use, forceps or vacuum? Well, it depends on the experience of the physician, the operator. I personally am very experienced in both, and there are many variables to decide from. They're pretty similar in their risks and benefits. According to ACOG, and you can see some links at the video site, there is a slightly higher success rate at getting the baby out with forceps than with vacuum as of 2022. Things change, but a slightly higher chance with forceps of getting third or fourth degree tears, which are bigger tears that take longer to recover for and have a slightly higher risk in the future for fecal incontinence, so having troubles holding your bowels in. That's a risk with vaginal delivery as well. Thankfully, the risks of that are low. So forceps are basically big giant spoons. They go around the baby's head, and there are many different types, not really useful to you at this stage. But they can cause bruise, marks, cuts along the sides. They increase the chance of you having a tear, as I just said. However, in most of the instances, they can reduce the chance of a cesarean section, and that often can have further consequences itself. So we encourage you to understand the risks and benefits, to discuss it with your physician, and it's always your option to decline to have that. In general, when I have patients in labor and there's a suggestion that there might be a chance of a forceps or vacuum, what's called instrument vaginal delivery, then I usually go over the information I'm providing here, the risks and benefits, because if, for example, there's an emergency when this needs to be done, we really don't have time to discuss it. And hopefully you don't encounter that, but sometimes things happen. What kind of things happen? Well, the baby's having some distress from the cord being pinched or some other circumstance. So I hope this has given you a nice overview of forceps, vaginal delivery, and there's a very close correlation with that with vacuum, so I encourage you to watch that. Thank you for your attention.